Hi, I'm Dr. Alessandra Colón from Miss Chiropractic in Palm Beach Gardens. There are a lot of opinions about chiropractic care online and on social media. You may have heard things like chiropractors break bones, once you start going, you have to keep going forever, or even chiropractic isn't backed by science. The problem is these statements often oversimplify what chiropractic care actually is and what it can and cannot do. Today, we are taking a new look at some of the most common chiropractic myths and comparing them with what evidence actually says so that you can make informed decisions about your health. Myth 1. Chiropractors put bones back into place. One of the biggest misconceptions is that chiropractors are literally putting bones back where they belong. That is not what's actually happening. A chiropractic adjustment is a controlled movement applied to a joint with the goal of improving mobility and reducing pain and nerve interference. Sometimes you may hear a popping sound during adjustment. That sound is actually caused by the release of gas from within a joint, similar to cracking your knuckles. Think about a stiff door hinge that doesn't really open smoothly. Sometimes our joints can become restricted and less uncomfortable than they actually should be. An adjustment is designed to improve joint mobility and help restore more comfortable movement patterns. The goal isn't to snap the bones back into position. The goal is to help joints move better and help you function better. Myth number 2, chiropractic care isn't evidence-based. Another common myth is that chiropractic care isn't supported by research. In reality, clinical guidelines and scientific studies support manual manipulation as one of the conservative treatment options for some types of low back pain, neck pain, and more. Research also suggests that certain patients with neck pain and some types of headaches may benefit from chiropractic care. It is also important to understand what the term evidence-based actually means. Evidence-based care doesn't mean there is one treatment that works perfectly for everyone. It means healthcare decisions are guided by the best available research, clinical expertise, and the patient's goals and preferences. For many patients, chiropractic care may be one component of the broader plan that can also include exercise, movement recommendations, activity modifications, and education about managing symptoms and improving function. At its best, evidence-informed care focuses on helping patients move better, function better, and make informed choices about their health. Myth number 3. Once you start chiropractic care, you have to keep going forever. Gosh, I hear this one all the time. The truth is, chiropractic care is completely voluntary. Some patients come in for a short period because they're experiencing an episode of back pain, neck pain, or discomfort after an injury. Once their symptoms improve and they reach their goals, they may decide they no longer need treatment. However, other patients choose periodic visits because it helps them feel like they can manage recurring symptoms or maintain the activities that they enjoy. Sometimes I compare it to exercising regularly, getting a massage, or working with a personal trainer. People may continue because they find value in it, not because they become physically dependent on it. You don't have to keep going forever. The frequency and duration of care should always be individualized and based on your goals and preferences. Myth number 4, chiropractic adjustments are dangerous. Another myth is that chiropractic adjustments are inherently dangerous. Like many healthcare treatments, chiropractic carries both potential risks and benefits. The most commonly reported side effects after adjustments are mild soreness, stiffness, or temporary discomfort that generally resolves pretty quickly. It's natural. Serious complications have been reported, but extremely rare. There is one reason why a thorough healthcare history and examination are so important. Good healthcare begins by determining whether a chiropractic treatment is appropriate for the patient. Understanding your medical history, symptoms, and individual circumstances help us guide decisions and allow patients to make more informed choices about their care. Myth number 5, chiropractors treat every disease. The final myth is that chiropractic care can cure every health condition. Chiropractic primarily focuses on the neuromusculoskeletal conditions involving joints, muscles, movements, and related pain conditions. It does not cure infections, cancers, diabetes, or systemic diseases. Good patient care also means recognizing when another healthcare professional may be needed. Sometimes the best course of action is collaboration with other providers or referral for additional evaluation. Understanding what chiropractic care is designed to address and what falls outside of its scopes helps set realistic expectations and supports better healthcare decisions. The bottom line is that chiropractic care is it's not magic, it's not mysterious. It's a healthcare approach that may help certain musculoskeletal conditions when used appropriately and by qualified providers. The key is understanding the facts, asking questions, and making decisions based on reliable information rather than just myths. If you've been living with back pain, neck pain, headaches, or movement limitations and would like to learn whether chiropractic care may be appropriate for you, we'd be happy to answer your questions. Thanks for watching, and I hope this helped, well, separate fact from fiction.